It is important to have a tertiary backing to your implant studies. Many dentists do weekend courses. They do not learn how to treatment plan. Treatment planning avoids damage which lasts for a long time. The damage that can occur are damage to the sinuses and damage to the nerves and blood vessels that supply your upper and lower jaws. The end result can be permanent numbness to the lower lips, damage to the feeling in your tongue, and chronic sinusitis. Postgraduate study is an extremely important process. It teaches you far more than just how to put the implant in the bone. It teaches you how to treatment plan and the aids to the treatment planning that you require. Successful implant surgery depends on treatment planning, and treatment planning depends on all the aids that we have at our disposal. OPG x-rays, CT x-rays, and radiographic guides to determine the spot where it is best to place the implants. I commenced studying implant dentistry in 1992 with courses at Sydney University. In 2003, I completed the 2-year postgraduate diploma in clinical dentistry, oral implants at Sydney University. I've placed over 1,000 implants over the period of time that I have been working. Dr. Jabor has completed a postgraduate implant course at Charles Sturt University. We use the original dental implant placement protocol of 3 stages to give the greatest chance of success and longevity of the implant. The world has speeded up, but the body's healing process has not. We allow 3 months after placement for the bone to grow onto the implant before exposing it. Some dentists have post-operative pain. We do not, as we have all patients take Nurofen preoperatively. This stops post-operative pain and swelling. Most patients have no pain at all after the surgery. In planning an implant, we use 3 forms of technology: a radiographic guide, an OPG, and a CAT scan. The radiographic guide is like a small denture and fits into the spot where we intend to place the implants. There are markers in this radiographic guide indicating the exact spot where the implant should be placed. An OPG X-ray is an all-round X-ray which indicates roughly the size and depth of the bone where we intend to place the implant. It also indicates any anatomical problems or features that we need to be concerned about when placing the implant. The CT then gives us an exact measurement in width and depth, so implants can be selected to fit into those spots. This is extremely important as the mouth contains large numbers of very important anatomical structures. There are nerves, there are blood vessels, and obviously muscles. The CT shows where all these are and shows exactly how much bone you have in the area where you wish to place the implant. When conducting the surgery, we use the radiographic guide as a surgical guide and place the implants in exactly the spots where the markers on the radiographic guide show on the implants. This allows us to avoid hitting any anatomical structures that can cause permanent numbness in the lips and the mouth and the tongue, and also avoid hitting any major blood vessels. Correct planning at this stage avoids all problems and allows us to have a successful and painless implant surgery.